Have you done a plastic surgery before? A question that people get asked for data collection purposes and sometimes just for normal situations. And to answer this question, according to Yek et al., in an article was published by US National Library of Medicine in 2014, in a survey was published to junior college students and medical school students in Singapore, asking them whether have they done a plastic surgery before and whether they have the desire to do one in the future or not. About 2.5% of junior college students said they have done one before, and about 3% of medical school students said also they've done one before, and about 44% of junior college students and 9% of medical school students said they have the desire to do one in the future. This shows a controversy between people in plastic surgery and whether some people support this thing or some people oppose it. And for me, in this speech, I'm going to be opposing the idea of plastic surgeries for two main reasons. First reason is plastic surgeries can affect people's mental health, and second reason is plastic surgeries can cause physical damages to people's bodies. Moving on to the first point, which is plastic surgeries can affect people's mental health. Some people think that if they are not satisfied with their look, they can just do a plastic surgery to make them look better, and therefore their confidence would increase and their self-esteem too. However, according to Carozzo et al., an article was published by PLOS ONE in 2019. Addiction to plastic surgeries can lead to negative consequences such as BDD. And what BDD stands for is that body dysmorphic disorder. And what this thing is that the ability of just thinking consistently about the effects that people have in their bodies, in which it would lead them to be exposed to severe depression later on. Another point is that according to Sanson et al., in an article was published by US National Library of Medicine in 2007, and studies were implemented for 7 years. The result of this study showed that there was an increased risk among women who have undergone breast augmentation and the desire of committing suicide. Another point that I want to talk about is that plastic surgeries can cause physical damages to people's bodies. Plastic surgeries have complications in general, and some complications can be associated with physical damages. According to Stanford Healthcare, in an article addressed as complications in reconstructive plastic surgeries, most of the common complications associated with plastic surgeries are infections, excessive bleedings, and difficulty in wound healing. Another point is that according to Konha et al., in an article was published by CSLaw, which is a website for a Brazilian hospital named as Revesta Hospital in 2002, shows a study was implemented on tissue expanders, which is a technology used in plastic surgeries, on 164 patients using 315 expanders. The results turned out to be about 22.2% of the overall cases were having complications, and half of these complications accounted for body burns. In counter of that, in an argument for that, some people might say that plastic surgery is like any kind of surgeries. People are aware of their complications and outcomes, and therefore people can just do it whenever they want. However, when people do surgeries, they would have to do that because they want to do this surgery to avoid something which is bigger than this complication. And that would leave them with no option other than doing this surgery. Let me share an experience with you. As you notice, I have a noticeable deviation in my nose, which I was born with. It's a congenital flaw. I used to not struggle from this conjunction. I used to not struggle from this deviation. This deviation led me to not be able to breathe from my right hole. I was able to just breathe from my left hole. Back in January 2021, I started to struggle from this deviation when I go to sleep. If my left hole was blocked, I'm not gonna be able to breathe from my nose, and therefore I would breathe from my mouth, and therefore I would be exposed to sore problems such as sore throat and hardships in swallowing and this stuff. So I went to the doctor, and he told me I have to do a surgery, and he told me he would modify the path of sinuses from inside so that I can be able to breathe from both holes, and it would have nothing to do with this deviation, which is the appearance of the nose. So he told me you have the option to do one operation or two operations basically in one surgery. The first operation would be from 1 to 2 hours, and the healing process would be from 2 to 3 weeks, and for the other one it would be from 4 to 5 hours, and the healing process would be from 2 to 3 months. However, I ended up just doing the one which I needed, which is the sinuses modification, and the healing process took me about 3 weeks, but my nose returned as it used to be before after 3 months. In conclusion, people should consider limiting undergoing surgeries as much as possible for two reasons: because they can affect people's mental health, and they can cause physical damages to their bodies. And in conclusion, people just have the option to just do a surgery, plastic surgery or not. But if they want to do one, they should consider the complications associated with this plastic surgery. Thank you so much for your listening, and have a good day.